My name is Anita Muñoz. I am a general practitioner in Melbourne. I'm also the chair of the Victoria faculty at the RACGP. We've known for decades that investing in primary care results in a more efficient health system, but it also improves preventive care and it results in better outcomes for patients. So we know that if you've got a child that's presenting early with symptoms of a mental health disorder, if that diagnosis can be made earlier and intervention can occur earlier, then the child is obviously going to have a better outcome. And there's many reasons for that are medical and psychiatric, but of course also social. Having children with long delays to get help has an impact on the way they develop socially, the learning that they do, their self-esteem, their self-belief, and their self-determination. So we don't want children to be waiting months or years to get a diagnosis and start on their journey towards managing their mental health symptoms. This is a really interesting study and it tells us about what I think a lot of GPs and parents already suspect, and that there is a big divide in terms of socioeconomic status and children's experience of health, particularly when it comes to dealing with mental health conditions, but also some other physical health conditions. And so what this study has demonstrated is that a child who receives care from a private general practice is likely to have a referral onto a private specialist much more readily than children who attend a bulk billing clinic. And there's likely to be some very good reasons for that are not totally explored in the study. And I'm sure we will see more work done on this, but we know that there are too few public health services, particularly to deal with things pertaining to children's mental health and children's behavioural disorders. So it's likely that GPs are unable to offer referrals to a lot of patients and their parents based on where they live, so just purely geography, but the fact that there are no freely accessible public health services where a lot of Australians are living. So it really does come down to, can a patient's parents afford to pay private fees for things like ADHD diagnoses and developmental disorders? Unfortunately for kids in lower socioeconomic areas, there is a twofold problem there, because children who live with a relative disadvantage or in lower socioeconomic areas tend to be overrepresented in terms of the population that has mental health diagnoses. So that's anxiety and depression, but it's also things like ADHD and other mental health disorders. Unfortunately, that is a population that has the greatest need, but they also have the least access because that's a population that would struggle to pay for private specialist care. That's a population that needs to be able to go into a public service and not have out-of-pocket fees, but of course in the areas where they live and just in the public health system in general, we do not have enough paediatric mental health or physical health services to meet those children's needs. We know that GPs all over Australia do the lion's share of care, particularly mental health care for all Australians, definitely also for children. And a lot of the chronic disease management, of course, is done in general practice as well. There are always going to be instances in which a specialist is required once the condition gets complex enough to warrant that kind of care, or if that's a preference of the patient or the patient's parents. But I think it's worth also noting that there are some systemic barriers to GPs doing more of the care in mental health in the paediatric space, particularly in ADHD diagnosis. Most people would be aware that there is a lot of advocacy happening around Australia to advocate for GPs to be doing the diagnosis as well as initiation of medication for adults, but also for children with ADHD. This has been done successfully in Queensland for over 8 years, and we know that GPs are capable of doing this. So in order to address the inequality in terms of accessing care in the community for children with ADHD, we need all of the states to be aligned on allowing GPs to make the diagnosis and to initiate stimulants. Throughout the course of this year, we've seen a series of announcements occurring around Australia where there's a recognition that not only can GPs do the work of diagnosing ADHD and safely prescribing stimulants, but it's actually necessary for equitable access for children and for adults, in fact, all around Australia. So states are starting to change their legislation to enable this, and the call now is, of course, for alignment across the whole country. So it doesn't matter what state a child lives in, they can see their GP and they can get access to care that can have a really big impact on the trajectory of their life and their experience of their schooling and their learning. We need all of the states to be aligned on allowing GPs to make the diagnosis and to initiate stimulants. That will have a big impact, particularly when we think about rural areas. We don't want to have children having to travel hundreds of kilometres to have assessments done when they could be doing that with their GP in their local towns. When it comes to health, we want all Australians to have the same experience of health irrespective of where they live and how they identify. And so crossing a border from one state into the other should not determine the experience that somebody has of health and the quality that they experience in the health system. I think that unification in terms of health equity across Australia is, I would suggest, something that's difficult to argue against, and yet we still continue to have states that have disparate laws about health access and health equity. I think all children in Australia should be able to see a GP and get a diagnosis for ADHD done expeditiously, and to use medications when they're needed without having big waits or having to travel many hundreds of kilometres just to see a specialist. So hopefully this is the beginning of a conversation that doesn't just speak to ADHD, but also speaks to a lot of the other disparate laws that we have in the various jurisdictions across Australia.